My name is Kirsty David, and I know many of you have seen the bio, but I am a peer recovery specialist, and I have been in recovery for 8 years myself. I'm also a mother, so that's why I'm so passionate about the work I do because I'm able to work with pregnant and parenting women. Pearl is the bigger program, and then Grace House is under it, and it is for recovery for residents that are pregnant and parenting. Kat, I'll let you go.
Sure. My name is Kat Adedia, and I am a person in long-term recovery. I've been a peer support specialist in Arizona since 2008 and working in recovery residences from 2010 on. I've been with Piedmont Community Services in Virginia since 2018 and started working back in the peer workforce with Piedmont probably around 2020, so right around COVID. I'm also really excited about the work that we do. I myself being a person in recovery and also being a stepmother. So this program is particularly exciting for us. First, I want to explain, like Kirsty mentioned, Pearl program is the umbrella service which Grace House falls underneath. And above Pearl, we are a piece of the Community Services Board named Piedmont Community Services. The state of Virginia has CSBs. Those CSBs operate, there's about 29 of us across the state. So Piedmont is just one of those. We cover 3 counties, and those are the very rural southwest part of Virginia. So we're looking at Patrick County, Franklin County, and Henry County, and that's all within our service area. The particular house that we're talking about and the Pearl program that you're learning about today is housed predominantly out of Franklin County, which is very large but very rural. So it's a lot of specifics that go into that. So whenever I say PCS, that's Piedmont Community Services, and CSB is that Community Services Board. We are a nonprofit. And yeah, we'll talk a little bit about the recovery housing. Other acronym we'll be using today is PPW, standing for Pregnant and Postpartum Women. So the program, like I mentioned, it's a bigger piece of Pearl itself. We started this in December of 2021. The reasoning behind that is there was only one other PPW residence that had been running for about 10 years in a nearby city, and it was closing down. And that was leaving zero PPW housing for anyone in the state of Virginia. And so Piedmont recognized the need. We did have a vacant old group home that was used for ID and DD, and so it was really a good setup, along with some assistance from funding, which we'll talk about later. We were able to transform that into a PPW residence. And we found that there was just a huge need to address after recognizing the opioid epidemic that we were having here, the overdose, the deaths, and because we're a maternal health care desert in all 3 counties, this was a huge need for our area. And that's what we wanted to do. So goal was for mothers to be able to come in and actually stay housed with their infants, be able to get wraparound supports, not just peer support, but the clinical component as well. We wanted them to receive specialized prenatal and postpartum care. Outside of just the clinical services, we wanted to make sure that they were getting doula services, which Kirsty will talk about later. And, this is one of the properties that Piedmont operates. We are operating 5 residences total. This is our only current PPW house, but we do have 2 men's and 2 standard women's in nearby Martinsville, which is about a 40-minute drive. This house that we're talking about today, the Grace House, has 4 bedrooms that are on the main living floor with a communal space and then one single apartment. This is the house itself. So that main level that where you see the cars parked, those decks, it's a very large house. We're very lucky. And I'll show you some pictures of what each separate room looks like. But this main level has a large kitchen, multiple bathrooms, 4 main large bedrooms, one additional bedroom that was converted into a staff office space, and 2 living areas, med closets, and formal dining room, and another living space, which is really lovely. So it's really large. And what you can't see is on the back end of the property, there's an additional access to the single unit. So some important things to consider about this residence. We ask peers to commit staying for at least 6 to 12 months. We don't try to time them out until you get to the point where your child is 2.5 years. So a woman can find out that she is pregnant, as early as several weeks into her pregnancy and move in then. You do not have to wait until you're close to giving birth. We take women at first, second, and third trimester, which is unique for our area. And we will take moms who have given birth if they've lost custody, but the goal is reunification. We'll accept them as well. If they gave birth and they have their baby, that's lovely and we want to include them. So we really want them to stay for as long as possible, not to transition out quickly. It is peer run. We are a VAR level 3 residence, but we are still peer run. We have the clinical component for supportive pieces, but every single staff that walks in that door on a day-to-day basis has lived experience and is a mother in some kind of role in their life. Grace House is in the heart of downtown. We really follow the social model. What you can't see to that right is a larger government office building, which is where Kirsty and I are housed. What is behind this house is actually our local farmers market. So there's free events and activities, family fun nights that go on directly behind this house, and the women can walk to that. In front of the house is a education center where girls can get their GED or, other like nursing vocational trainings. And then off to the other side is the city library, the town library. So there's a lot of access to resources. If you walk up the block, literally one block up, there's a church and that houses fellowship meetings, NA and AA meetings several times a week. So we're very lucky that this property is surrounded by all the things that we need. They do help with some things like transportation, but we encourage utilizing some resources. We do use Medicaid transport, and on weekends we have access to a larger vehicle, so we transport the babies and moms to larger meetings. And of course, there's recovery groups inside the house on a daily basis. There's some kind of structured recovery group going on every day in the house. Here's some pictures of what the house actually looks like. So you see the standard room that's on the top left corner. That is pretty much what every single room looks like. Every mom has a queen or full-size bed, a separate area for the child to sleep because we are not encouraging them to sleep with their babies for safety reasons. They all have dressers, armoires, closets, their own TV space. There's no doubling up in these houses, and we'll talk about reasoning for that later, but this is a typical room up on the communal floor. The other three from the right down, those three pictures are the single unit that's downstairs. We use that as like an advanced placement or step down. So for mom and baby who maybe have been doing really well and are trying to transition to more independence, they have everything they need basically in that unit. And the expectation is that they still come up and participate in groups. They still participate in all the house activities, but they have a little bit of transitional time to get ready for life on their own. Some of the wraparound services that come from Piedmont are things like the Community Recovery Program. We call that CRP. CRP is a peer-ran employment program. It's one of the programs that I operate. I operate 5 peer-run programs within Piedmont. CRP offers on-the-job training, which is paid, like a paid time where they can, about 6 months to a year, work on soft skills and janitorial cleaning crew, do internships at local organizations, cooking, contracts, all kind of things where they're able to actually get paid while they're in that program, as well as working with employment specialists who will help with resume building, interview skills, mock interviews, and those things. Of course, everyone has access to SUD case management, connections to long-term housing and quality childcare. So we work very closely with our community partners to get them in on childcare programs, connecting them to other cities that are very close to us that have more housing programs as well that are longer term and maybe not specific to SUD. There's workforce development programming, nutrition and health education, budgeting assistance. We're working with United Way and Bank On to try to make sure that all of our recovery residents, people have some fiscal health and well-being. Most of our moms are involved in the Healthy Families program and Strengthening Families, so about a 12 to 16 week course where mom and child work together. And the perinatal education centers listed on here, it transitioned out, unfortunately, was closed down. And now we're working very closely with Huddle Up Moms in Roanoke. So it's still not too far away, but they picked up a lot of the pieces that the perinatal education center used to do. And the doula birth and postpartum services, we get training from Jonah International, and almost all of our staff are either birth or postpartum, and some of them are both of those things. Some of the unique pieces, I think, for Pearl are that we are VAR accredited. We are a level 3, which is a type S, meaning it's supervised. We've been VAR accredited since 2022. So we opened December of 2021, got accredited by April of 2022. We've maintained that every year. And DBHDS this year in Virginia required that the houses get licensed and registered through the state. And so we did that very easily because of our collaboration with VAR. We've always met those requirements. So we've also been registered since 2025. Our AccuDetox trained staff, I don't know if anyone's familiar, but we'll talk about that on a slide later on. We have AccuDetox trained staff. Several of us here, Kirsty and myself both, are those individuals. We provide the 5-point needle protocol, which has just been phenomenal for some of our women. We provide this for staff and for the participants. Each mother gets Safe Sleep certified. Kirsty can talk about that also when she talks about doula. We are MAT friendly for all of MOUDs. So a lot of the houses that we were surrounded by, and when I say surrounded, I mean by about an hour, 2 hours away from us, they were accepting some mothers, but only into second trimester. They were accepting some mothers, but only if they were on Suboxone. They were not accepting methadone. And so that was a huge barrier for some of our moms that were seeking treatment. We accept methadone. Piedmont does not prescribe methadone. We do prescribe Suboxone, but we work in collaboration with our local comprehensive treatment center so that the moms are still able to get their methadone treatment without having to drive and do daily dosing every single day. They're able to work with us and get those meds delivered on a biweekly basis, which has been fantastic. There's zero cost to move in. You don't have to come in with a dollar. You don't have to have anything scholarshiped. We want to remove as many barriers as possible. We do have a sliding scale fee. It starts off at $10 a week for what we call resident fees, and the max that anyone would ever pay if they've been here for like 6 months or longer would be about $75 a week, which runs out to $300 a month. We find that's very reasonable. We've also never removed anyone for inability to pay. We've had moms who have stayed 6 months, 8 months, and we are not asking them to exit the program based on their inability to pay. We recognize that moms move in. It's very hard to get a job while you are pregnant and showing pregnant. It's very hard to get a job and balance going to the groups that you're required to attend. It's very hard to get a job and balance your time commitment of your medical appointments and your OBGYN appointments. So for all of those reasons, we're able to be very lenient on the residential fees. And like I mentioned, we're low threshold and low barrier. You do not have to test negative for substances in order to be accepted into this house. That is not a requirement. You could have used that same day, and we are not going to hold you back from being able to access the house. You can't use substances while you're in, obviously, but there's no time requirement. Some of the other locations were requiring that the mothers were going through like a 2.5 or a PHP placement before coming into the housing, or they were requiring them to go through a detox first before coming in. The only time we would require that is if someone were coming, experiencing the withdrawals from alcohol symptoms and had a history of seizures or opiate withdrawals and had no medication to manage that. That would be our only barrier. But not having a dollar to your name, we do not need you to have Medicaid. That is not a requirement. You can come in from other states. We are not going to hold that against you. So we have applications from all over Virginia, but we would accept anyone from another area as well. So none of those things are going to be barriers. Also, we do receive, this year was the first year that we're receiving state indigent bed funding assistance. So just we work very diligently to make sure that the moms don't incur more costs than what they need to. It's already hard enough being a mom going through this system. So we're working very hard to make sure that we're not hitting them with unnecessary costs. Here's a little bit of information around the AccuDetox service. We also call this AccuWellness to be more recovery friendly. On the picture here, you see Victoria Jean, who is our Virginia state trainer, providing the service to one of our CRP staff, Viola. And it's amazing. If any of you guys have ever received it, you know the power of it. This treatment can be provided by medical professionals, it can be provided by case managers, it can be provided by peer recovery specialists. And so here at Piedmont, we have about 7 staff that are peer recovery specialists and AccuDetox trained, and we have probably about 3 additional clinicians who are trained that provide it as an alternative to verbal therapy or like in between case management sessions. We've also gone into the community and provided the AccuDetox treatment to first responders. We've assisted with like First Responder Summit. The Department of Corrections asked us 2 years ago to come in and provide the AccuDetox treatment to some of the officers. It's fantastic. It does not require anyone to do verbal therapy. That's the benefit of it. Someone can just sit there and be present and listen to ambient music or sit in silence, and that gives them 45 minutes of their day where they're just able to receive the benefit. There's a webinar I believe you guys are having come February where there's some other like state trainers from the NADA, which is National AccuDetox Association. And so you'll get more information on that. But it's all about energy work and it requires really nothing other than the fact that the person is volunteering to receive the treatment. If someone is uncomfortable with the needles, which by the way are similar to regular traditional acupuncture needles, they're very small, smaller than a hypodermic needle. I still recognize that some people are fearful of those. It's only 5 in the ear. Someone has the choice to say that they want all 5. They can choose to do 1. They can choose to do all 10. It's up to them. And if they're really uncomfortable with the idea of having the needles placed in their ears, there's an alternative that's called beads and seeds. It's literally a Vicaria seed or a metallic bead that is stuck on the side of a bandage, something that you would look almost like a Band-Aid, very, very tiny. And those beads are placed on the same places in the ear that a needle typically would be placed. Those 5 locations are attached to the sympathetic nervous system, which helps someone physically relax. The second point is the Shen Men, which helps somebody literally like relax mentally. Then you have your kidney, liver, and lung points after that. So someone can choose to get 1 needle, they can choose to get all 10, they can choose to just do beads and seeds. Either way is great. We can provide that service up to 3 times a week if the person wants, and if they just want it to be sporadic, that's perfectly fine. We can provide it here in the house. We can go outdoors and do it. It's very easy to transport that anywhere to the office or at the house. Again, it's nonverbal, so the great thing is it's not like a therapy session where someone has to bare their soul. The only thing they have to be willing to do is just to sit there. It is effective for SUD, but also a variety of other mental health challenges. We don't promise any cures with AccuDetox or AccuWellness. Some people find that they relax and sleep better later on. I myself get more clear and more energized from the service. Coming from the perspective of a provider, it's very cost effective to become NADA trained. For the actual training itself, you're looking at about a $600 per individual to get trained. And that $600 includes the training, your initial supplies, and the $100 membership fee for the year. And then after that, your membership fees are $100 per year. Very reasonable if you're an organization like us that's a nonprofit. The supplies, because they're medical supplies, are very reasonable as well. And so really you can run a solid program using AccuDetox and AccuWellness for about $300 per year, depending on the frequency of service, how often you're doing this. And of course, the less invasive beads are an option too. And someone can leave those on for 3 days at a time if they want. They can take them off right away. It's really up to them. Some of our partners um, have just been obviously Piedmont Regional Community Services. That's our CSB. That is our overall agency. We are considered an OBAT, so an office-based addiction treatment. We are a preferred OBAT, meaning we have a full volume and a robust service variety here on site. So you do have an opportunity to have an OBAT care coordinator. We do have trauma counselors. We do have SUD specific programming counselors just for this team. Everyone can have access to the nurse prescriber. We do, like I said, offer the Suboxone as an option for our providers, but we don't provide the methadone. Everyone that comes into Pearl, and especially the Grace House, has the opportunity to attend the Her Group. Her Group is held on Thursdays. It's the Healing, Empowerment, and Recovery group for PPW and SUD. So we welcome individuals who don't even live at Grace House. They can join this group as well. So anyone from the community could be able to participate. They don't necessarily have to be in services with our Community Services Board to attend. And because it's peer run, it's voluntary. We, of course, offer referrals to healthy families. Of course, everybody that's in the house has opportunity for case management through DSS. And we also have some Virginia Department of Health new programming for the mothers that are offering some assistance in some case management as well. And then, of course, Piedmont Regional takes care of all of our recovery residences. Like I said, we have the total of 5 right now. And then, of course, we have community outreach. One of the ways that we funnel referrals into Grace House is through our Pace to Recovery warm lines. Those are 2 warm line numbers. One is associated to Franklin County, one is associated with Henry County, but either a peer from the same program will respond 24 hours a day. Anyone can call and ask about peer services, and they should be able to navigate them. If someone calls and says, I'm pregnant, or I have concerns, or a family member is pregnant, or trying to stop using, or needs help, that Pace to Recovery program can contact Kirsty, myself, any of the other Pearl program staff, and help get them connected with a housing application, which is pretty straightforward, and it's essentially 2 pages. So it's not difficult to get through that application at all and get that faxed in. After we receive the application, we have 72 hours to set that interview up and decide if we're going to get that person in. We've actually moved people in within like a 24-hour time frame. So rarely we've been able to get people in very, very quickly. We also have partnerships with Carilion Clinic. Carilion is one of our local hospitals. They have prenatal care coordination and the OBGYN addiction specialist, which is massively important for us. Like I mentioned at the beginning, we are in a maternal health care desert, so we have no labor and delivery services in Franklin County and none in Patrick County and none in Henry County. So the 3 county around us, we have no L&D. And so our moms, that was the other reason for Grace House being so imperative for our community. Our moms have to get transported up to Roanoke, which is about a 40-minute drive, or to Danville, which is much farther away, to give birth. In fact, Patrick County doesn't even have a hospital in the whole entire county. So we have a huge lack of services. And something that's made us very successful is Carilion Clinic. They worked very hard to create the Bridge to ED program, which connects people from overdose, withdrawal symptoms, anything involving opiate use disorder, getting them connected to services quickly. So Carilion was a huge partner with us. The doctor who works closely and is the addiction specialist is Dr. Kim Simcox. She's probably going to kill me for having this picture up, but she's fantastic. She contracts with Piedmont every single year. We've had her for all 5 years consistently and hope to continue doing that. She travels to Grace House and can do in-person services. She can see them in person at the office, but certainly will come down here even on a weekly basis if we need to. As a mom is preparing to give birth and things are kind of escalating, she'll come more frequently. She'll sit and just talk to the mothers. They really appreciate what she does. She comes from a non-judgmental, very recovery focused, uses recovery language, and also partners with a peer recovery specialist up at Carilion in Roanoke as well. And so they've really included peer recovery specialist work into their program, which they call the Emerald program. Let's look. Funding support. One of the questions that I get often is how are you guys able to maintain the house and how did you guys get assistance with this? First and foremost, our state opioid response funding, that SOAR funds, that covers costs of staffing, though obviously things have become a little bit more challenging in this last fiscal year, and that SOAR funding really only covers a portion of staff salaries. The Medicaid billing, we are able to bill Medicaid in Virginia as long as you are a registered PRS. There's a lot of requirements that go into being able to bill that service, though. And for this state in particular, the billing reimbursement rates are very low. So we just do not rely on Medicaid billing to fill that need. Also, again, like I mentioned, we'll accept babies and mothers who don't have Medicaid or are uninsured or underinsured. And so we might have mothers who have no insurance for months at a time, and that's not going to stop them from coming in. We do use opioid abatement authority funds. For the initial creation back in 2021, we used a large portion of that to help us get this house ready. We're hoping to utilize those funds again as we work towards expanding this program. We love to include more houses. There's definitely a need for it. We had a grant that was a COCOLI grant, a small grant that was able to help fund staff, special projects like photo voice programs where the mothers who were really successful were able to create audio and visuals that they could share amongst other people and out on social media to show the progress of what they went through when they first came in to where they are now as mothers with healthy children. The Virginia Rural Housing Authority has supported us with doula training, AccuDetox assistance, and our on-call services. Something that we've had to put in place with this house is obviously you're dealing with women who are pregnant and could have complications or babies who need immediate care. And so we do operate a 24-hour on-call system between Kirsty, myself, and we have licensing people as well that can support from a clinical standpoint if needed. So, in order to keep that line open and be able to be receptive, VHRA has been hugely successful. Some of our other partnerships that have been really important for us have been the Virginia Tech Policy for Governance. They've done that photo voice project. They assisted us with the COCOLI. They also helped us with some research programs and data collection, especially at the beginning part of this project. We wanted to show that we were actually improving the lives of the moms we were serving. We were able in our first year to serve, I think, like 8 mothers for long term. The next year was like 13 mothers. This year we've had 4 mothers, which seems low, but that is because they've all been in there consistently. It's been the same moms. We have great rapport with them, and I think they'll be with us for long term. So we're excited. In fact, 2 of the moms have been here. One mom has been over a year, and then the next one just about 9 months or so. So we've got some ladies in here that have been in for a while. Our Department of Social Services offers things like the VIEW program. They actually have assisted our moms with getting vehicles and getting gas cards as they work towards independence again. So once they're ready to go back into work. TANF, of course, we have family partnership meetings with them, childcare subsidy programs, making sure that the moms get help with getting the children into childcare. And then Roanoke Comprehensive Treatment Center, they are the ones that provide the methadone. Like I said, we have a memorandum of understanding in place with them so that they deliver here twice per month. We found that this really helped avoid the daily dosing, the frantic daily dosing fear. Because there's no methadone providers within like a 40-minute drive radius of us, every single day our mamas were relying on Medicaid transportation to get here at like 5 in the morning. That was inconsistent at best. Then they were rushing out the door, trying to get dosed, get their medication treatment, trying to rush back in time to attend groups or maybe go to their other doctor's appointments. It was just creating a lot of chaos and wasn't really fully supporting the recovery model that we were looking towards. So the RCTC came in and said, listen, we'll work with your ladies. If they're in the house and they're doing well, we'll be able to go ahead and give them these 2 weeks at a time to eliminate that like rush and the fear and what if something happens and we're missing doses. We wanted to make sure that the mom and babies were healthy. And I'll hand it over to Kirsty to talk about the doula work that she does.
Okay, so I am a birth doula and postpartum doula. So, a birth doula is a professional support person trained in the need of the birthing person and their family during pregnancy, childbirth, and early postpartum period. All right. So, as a birth doula, we help advocate during birth. I know for me, I was able to experience 3 births, which is what you need to get certified to become a birth doula. But I was able to see 2 natural and 1 C-section. And I know during one of that natural births, the mother's birth plan, which is something else that we do with them, she wanted it natural. Like she didn't want to have medicine or C-section if possible. So I know during this birth, there was a time when they were having a really hard time getting baby out or positioned correctly. And I remembered in my training that we were taught how different positions can help move baby along. So I asked the doctors if we could try a different position. Instead of laying on her back, we did on all fours. And that actually helped. And she was able to have a natural birth and it was safe. It helped. So that's one of the advocating. Like I said, we make birth plans with mom. We'll do that in the early stages just because you never know if they want to change it. We support the birth mom and her wants. We help moms deal with unexpected because we always know that all births aren't the same and anything can happen, good or bad. We provide comfort measures such as massage and gentle touch. There's a lot of techniques, more than you think, when it comes to the gentle touches. We educate on different labor positions along with evidence-based education. But also, I was going to say, like with the birth, so to be able to get certified, after you take your class, you have to complete a approved class workshop. Then you have to, but this is what we had to do, become a donor member because that's who we went through. We had to fulfill the childbirth education requirements. One of those requirements is you have to do a lactation support class. So we did that. You have to do reading assignments. You have to write two papers on four books. You do a self-assignment questionnaire. You complete a resource and referral list of your community. So you have to reach out maybe to other doulas or just anybody in the community that could help with the birthing or doctors. We have people in Roanoke that help moms, but that's more postpartum. After we complete the workshop and attend the three documented births that I said, we have to purchase the application, do it all, and then complete, and then you are a doula, a birth doula. So, postpartum. A postpartum doula is a woman professionally trained in newborn care and postpartum health to support, educate, and care for mother and family in the weeks and months following childbirth. All right. So some of the things we do, we support mom. So we have four staff here at Grace House, and so far three of our four are all trained in postpartum doula. So we definitely have enough. Well, we have staff that can wrap around and help mom during postpartum with all these things. But we help with light housekeeping because mom just having a birth, we all need help after that. We set up and help organize the nursery or the room at Grace House, in-person emotional support and education. We have actually ordered a bunch of education and tools that we like to use with the ladies. We use practical tools such as affirmation, sorry, and mindfulness techniques. We do movement and breath work. It guides and nurtures the mom, and we guide and nurture the mom in every step. We also have a checklist that we use if we notice a mom possibly showing signs of postpartum depression. And if so, we can link them with their PCP or their OB. And we also provide the tools I spoke of before to help with clinical aspects of that. So we teach mom how to comfort and soothe newborn. We answer questions about expected newborn behaviors. We explain newborn care to them. We facilitate parent newborn bonding. We assist with mom's emotional and physical recovery after birth. We assist with feeding support, whether that is breast or bottle. Like I said, we are trained also in the lactation support, so that helps us there. We assist and teach mothers with lactation. We help moms meal prep. So when they are breastfeeding, that they don't have to take the time to have to cook meals. And, when moms are breastfeeding, they need that extra nutrition to be able to pump or feed baby. Newborn care and babysit for moms to shower or get an hour of sleep during the day. We really aren't child care, but we do help an hour to let mom just get some rest or whatever she may need to do just to have a minute to herself. Okay, Kat.
Great. Thanks. I'm so glad that Kirsty and her team do the doula work because I could not do those things. So I appreciate all the doula services that they provide. So some of our limitations, things that are barriers for us with Grace House, we do not accept bed-to-bed transfers from legal institutions, so there's no bonding that we receive. We're peer run, and so the nature of that means that the individual needs to want to be here, not that they're being forced by a judge to do so. Also, if someone were to leave and go on the run, we do not want to be the reporting agency to that at all. Again, it takes away from the peer relationship. We do receive individuals who are justice involved, so they can be on probation, they can be coming out of incarceration. That's perfectly fine, and we're happy to receive them. It's just no bonding and no bed-to-bed transfer. They cannot be court mandated to our program. Again, justice involved mothers, absolutely. If they're involved with CPS, certainly. If they're coming out of incarceration, certainly. None of those things are going to be a hindrance. We don't accept long-term pain management patients. We're just not equipped to deal with individuals who are coming in with like long-term anxiety medications, long-term pain management meds, especially opiates. So benzos and opiates can be a struggle for us. If a mom comes in and has been a long-term recipient of benzos and is wanting to titrate or, wean off of that, and that's one of their goals, we would work with them and we would be willing to accept that person. And then the mother is required to have custody or be working towards reunification. So we do have some moms who come into us, they had immediately lost their child right at birth because of maybe testing positive for substances. And if it's their first situation, CPS might say, hey, we're willing to work with you guys. Let's put a safety plan in place. We can work with visitation. And after a few weeks or months, if everything is going well, mom can be fully unified. That's not a problem for us. If CPS is involved, has taken the custody, if the child is working towards adoption or most likely not going to be unified, then we have the other two women's houses that again are located in about a 35-40 minute drive from us and are still underneath the Piedmont umbrella, and they would be welcome into that location. Some of our special considerations that we had to learn in operating in these rural locations, and when I say rural, I mean rural. Franklin County doesn't even have a city in it. The place where Grace House is in is Rocky Mount, Virginia, and it is a town with a population of 5,000, less than 5,000 people. So there was a lot of considerations that we had to take into place. Lessons learned from COVID. There are other PPW residences that put two moms into every room, two babies into every room. We will not do that. Every single mom gets her own independent room. We have had two babies, like if there's a set of twins born, certainly two babies, or if we had triplets, they could be in one room. But illness spreads very quickly with children. So if we have a round of pink eye or RSV, a respiratory illness, we do not want that spread amongst other moms and babies. So everyone gets their own separate space. We're very lucky the house is large and everyone, if we need to quarantine, can kind of do so pretty well. There's 3 bathrooms amongst 4 residents upstairs. There's the other space downstairs. So definitely took that into considerations to have backup plans, how moms can attend other recovery meetings and fellowships. If there is illness in the house, we can do a lot of things virtual. And we have an app that I can show you here in a minute that can also support women if for some reason they need to quarantine. Living in rural Franklin County, when weather hits, we lose power. We're facing that tomorrow, probably. So, needing things like alternative power sources, making sure that the moms have supplies they need. We have a baby that is on a G tube and it needed a power supply for a long time. Now she's on a JG tube. So, not so many. The power supplies last for hours and hours, but we need to make sure that the moms have all the medical equipment that they need for their babies. Transportation, ensuring that we have a vehicle large enough to transport. Again, once we ran into having mothers that had twins, that's more car seats, more moms, more babies. And so getting a vehicle that's like a 12-passenger van has really been imperative to make sure if all the women want to go to the same meeting at the same time, that we can transport them together. Staffing coverage for when moms need the most support. So this is not an 8 to 5 program. Accidents and incidents don't just happen Monday through Friday, 8 to 5. There are staff at this house 7 days a week. 4 of those days, it is staffed on site from 8:30 in the morning till 8:30 at night. The other 3 days, staffing are there till about 5:30. And again, there's a line that Kirsty and I share responsibility for. And so if there's a crisis, if mom is ill, if there's a concern with the baby, if something happens at the house, one of us can respond to that house usually within, 5 to 20 minutes tops. And so we're there to help out. But staffing coverage was really imperative for this house. We had to consider babies with higher needs. Right now, we have a mother in here that has a diagnosis. She's living with MS. We have a child who was recently diagnosed with cerebral palsy. And so you got to take into some consideration possible illnesses, things that they might need assistance with. Again, electronic support or assistive technology might come into place. We have had a mother who wasn't able to carry full term just because of heart conditions. So making sure that we had supports in place, clinical supports to be able to help her in a therapeutic way, as well as having peer supports there to help comfort her was really imperative. I mentioned that we have a health app that we work with. Chess Health has been great. They are an application that anyone who receives SUD services with Piedmont has been able to log on. Staff like myself or another administrator, we can get people with their, as long as they have a smartphone, we can go ahead and get them connected for free with this app. I usually show my personal one just to show what it looks like. It's very user-friendly, easy to navigate. It'll greet you every time showing your recovery tracker, how many days you've been in recovery. You get to do a daily check-in. There's journaling, there's mindfulness practices, there's chat groups. It is also completely peer run. So anyone who's in that chat, anyone who's responding to questions on the app is someone lived experience through either mental health or SUD. Yeah, so it can be accessed by any kind of smartphone, computer, tablet. Has the recovery tracker. It has gamified some of the targets without crossing over into like gambling. Has a life preserver at the very bottom of the screen so that if someone were to tap that, it asks them, do you really want to talk to someone in crisis? And if so, yes. On the back end, if someone really does reset their sobriety date or accesses the crisis support, one of the administrators, like myself, we get a notification that this person was in crisis and we need to follow up with them. And there's also a companion app. So Chess Health has Connections is the main app for our women to use. And the companion app is for a friend, family, loved one, anyone who supports, anyone who would identify as like a family support partner or, people who just support others or want to be informed about recovery. They can join the companion app at no cost as well. Great thing about Chess is there's literally a PPW section, so specific to women who are pregnant and parenting. And of course, we have Kirsty, part of her contact information here at the bottom, and a lovely quote from her. That's her beautiful daughter. Love it. Thank you, Kirsty. And here's some of our contact information. You can contact either one of us if you have questions around Piedmont Community Services. Certainly, you can contact myself. Anything around peer run services, I'm a great contact for that. Anything specific to PPW or recovery residence for women would be Kirsty. Her email and her phone number is listed on here as well. And I think we have plenty of time for any questions. And I wasn't paying attention to the chat.
That's all right, Kat. I've got you on the chat. Just want to say thank you to you and Christy for your excellent presentation about your Pearl program. I know it certainly sparked a lot of questions for me, and I found myself sitting here thinking, gosh, I wish every rural county could have a program like this. What an amazing job you guys have done, and just super impressive. We really, again, appreciate the insights that you shared. So we did get a couple questions in the chat, and then I had a few questions too as we went through. So one of the questions that we got, which I thought was really interesting, is so you're working with the mothers, you're working with the children and the babies. So how do you involve or foster, how do you foster involvement of fathers? Like, how do you get the fathers involved in the program?
Great question. We do have several moms throughout the years who want to incorporate the fathers in the parenting process. The other parent is allowed to come and do visitation here. They're not allowed to go into the independent like living spaces, the bedrooms, but common areas, we encourage that. We want the other parent to come in and visit and spend time. We allow the women also and encourage them to go out and spend time with family members if there's a safe environment. If the partner has a safe environment that they can go and do visits or overnights with them there, that's okay, as long as it's safe. If there's a concern about the other parent, maybe the other parent had some intimate partner violence, or maybe the other parent was the one that was testing positive, and for that reason there was concerns. We have to navigate that very closely with DSS and work within the safety plan that they set. But we very much encourage not just the father, but extended family members. We have aunts and grandmas. Anyone else who's a support to that mom is welcome to this house.
Wow, that's great. That's great. I know we as the Fletcher Group have been doing a program in recovery houses for fathers, getting recovery houses to be father friendly and it's been a phenomenal program. So that's great to hear. Another question that came up in the chat is, what is the cost of the integration of the Chess app for an organization? So I think wondering what's the cost of that? That's something I also was thinking about as you were sharing that. And I would add on to that question, and how were you able to provide it to your participants for free? So what is the cost of integration of the app and how are you able to provide that for free?
Sure. So, Chess Health, there is a cost associated with it, and there's a membership. I don't want to speak too much on their cost because what we pay might not be the same as what everyone else pays for access. But you can do like month to month, I believe, with them. With Randy Polito had offered us some month to month service with Chess app. It can be in the thousands. Some of that was funded through grants, and so that's how we were able to support that assistance was from grants.
That's great. That's great. Another question that came up is, could you describe the kind of vehicle you think is ideal? I know that vans can come in regular or tall. How many seats, other features that you think would be helpful for someone maybe thinking about starting a program like this?
Yeah, that's such a good specific question because I'll tell you, we've looked into that, obviously. We found that at one point we were looking at the Ford Transit. I think it's a 250 12-passenger van. The reason that we were looking at that van specific was it rides fairly low, has the side step. The newer versions, like 2024 and up, and newer are all the bells and whistles with the cameras and safety features and all the handles and those kind of things. And we just found that the ground clearance on those were particularly easier to access. Financially seemed like a great approach as well. I would opt for a 12-passenger van versus a 15-passenger just because staff are driving these vans. 15-passenger can get kind of tricky. The smaller, like minivans or mom vans, soccer mom vans, while they're okay for getting girls to and from in town, if you're doing multiple trips, those smaller vans don't work if you're driving 30, 40 miles getting them to a group meeting or a medical appointment or something, you'd have to make multiple trips. So it just doesn't work to get all moms and car seats. So 12-passenger van, kind of ideal. If we're maxed out at 5 moms, that's 5 moms plus 5 potential car seats plus a staff. So 12-passenger seems ideal for us. Kirsty, I don't know if you have any feedback on that.
No, I mean, I think that's correct because as of right now, we have a normal sedan and borrow a van from another program. So, yeah.
Yeah. We looked at operating with like a small, like a shortened bus that is used for other like ID and DD services. Problems that we found were again too wide to kind of drive our narrow rural roads where we're not driving on surfaces that are always paved. We're very rural. So those larger like vans or small buses, compact buses, were maybe a little bit harder for people to navigate. And even though they had steps going in, it was still kind of difficult that first initial step unless you had the gate. And at that point, it seemed a little unnecessary. So really that 12-passenger van, and I think it was that Ford Transit was kind of what we were looking at for ideal.
Great. That sounds like some great information. Another question that came up is, do you have a model slash flow chart of this program from start to current? And who was the program presented to first for buy-in? Partners that may have piloted this with you. And I think this kind of went to one of the questions that I was having as well while you were talking is, man, your list of partners is quite large.
Yeah.
How did you get all the buy-in from all of those different partners? And yeah, do you have any kind of a flow chart or model for the program from start to current?
That's an excellent question. So I will say, I do think I think I have a slide deck that shows the initial progress. It did happen fairly quickly, and I'll say it's because of that loss of the original home that was in Roanoke, and it was called Bethany Hall. It had been around for a long time, and that was kind of that was the flagship program for SUD and mothers, right? And so once that was closing, everyone kind of went, uh-oh, what are we going to do? Like there's this massive need. And so it really wasn't difficult to create buy-in. You were facing the opioid epidemic, right? We were having a huge influx of deaths, overdoses. Our community was hit very, very hard by that. And then us being a maternal health care desert and not having the services, it wasn't hard to create the buy-in. We had very quick access to letters of support from our Virginia Health Department, very quick supportive letters and partnerships with Carilion Clinic. Those things really were not difficult to build and create because they saw the need. And in fact, since Grace House opened, we were asked by several other providers how we did this. And so we've given them feedback. We've assisted anyone. You're welcome to reach out to us and ask us how we did it, and we will work with you and give you some advice along the way. But since we've opened, we have seen about seven other PPW programs open up fairly close. Some of them are just not as equipped to deal with like longer term and again, not full trimester. So some of these programs that opened up will only accept women for 4 to 6 months, or, they'll only accept them as a step down if they've already been in services somewhere for a certain length of time. So there's things that are similar and they maybe just aren't equipped to deal with the full spectrum. We're able to have a full, robust amount of services because of being part of the Community Services Board. And because we're a CSB and we've been established for over 50 years, I don't think that was hard to create that trust and buy-in for this project.
Okay, that's great. Someone is also asking, do you have the contact information for Grace House? If so, can we put it on our resource list?
So I would say that I'm the program manager. So I mean, reaching out to me, my email's right there, Kirsty David, and my phone number. And if for some reason you can't reach me, then that's when you would go to Kat.
Perfect. Another question is, was DCS workers slash caseworkers brought on board during pregnancy in the event baby is born chemically dependent, supporting family unity? So I think they're wondering if the DCS caseworkers or workers were brought on board during the pregnancy. If there was if the baby was going to be born chemically dependent, or if there was a thought about that.
So I will say we have, right? But not necessarily. So we have mothers who already maybe have other children who have been in the system. Some of our moms, this is not their first child. This is maybe their fifth child. Maybe while they were pregnant, they were at another clinic and that was reported. Not every place is recovery friendly for mothers. A lot of mothers that were seeking out treatment for SUD were didn't get the services they needed because they were being, in fear of being targeted, of getting reports. So we've worked with moms who have no involvement, but know that there will be involvement the second that baby tests positive at birth. And we have those things in place. We navigate that with them. Listen, you're going to test positive. We're going to navigate through this. Like, as long as we're working with the program and working with DSS staff or CPS staff, they will work with us as long as you're in Grace House. We work closely. Some people have those previous cases already in place, and sometimes from other locations, like other counties and catchment areas. So it can be both or it can be neither. We have some moms that have zero involvement.
Okay. Another really good question that came in was, can you talk a little bit more on postpartum programming at Refuge for Women's at Refuge for Women? Weekly drug testing is required, but there are other requirements like biweekly one-on-one meetings with our program director. What is realistic programming for a postpartum mom? I think that's a great question.
That is a really good question. So when someone comes through our services, they don't already have to be connected to Piedmont, but we do eventually get them through same day access to, get a clinical assessor to make a recommendation. That mom might be recommended for like an intensive outpatient. She might not. She might be recommended for a lower level of care. If the moms are recommended for IOP or OBAT services, you're looking at 9 hours a week of groups just for that program itself. So we always ask that they follow through with the treatment plan that is provided or recommended from the clinical assessor. But outside of that, they can choose not to attend those. But inside the home, they absolutely have a group every single day. It can be as simple as a 1 hour group, or they might have like a specific meditation group. It could be something outside of the typical her group. And then they all have at least a one-on-one a day with a peer support staff. Outside of that, I think Kirsty could probably respond to anything else, but requirement is every single day they're getting seen by a peer support specialist, and every single day they're in at least one group, even if it's only for an hour. Kirsty?
Yeah, we do random drug screens at Grace House. We have a activity log, and in our guideline, it states that they have to do 5 to 7 recovery activities a week. That's also a requirement here at Grace House. But yeah, normally when we have like every staff is here, we normally do 2 to 3 groups a day.
Mhm.
Each staff will do a group with them. I mean, some can just be fun groups. It just depends, but they do come to all groups. So
Mhm.
that would be our main.
We encourage our partnerships with like Recovery Church. We are not a faith-based program by any means. That's not our wheelhouse, but a lot of our moms choose to do like a Celebrate Recovery or a Recovery Church option. If they want to utilize those as their recovery activities, we encourage them to do that, seek services outside of just the house. We don't want them to just isolate and be in the home.
Sure. So it sounds like that's a good amount for folks. So especially someone suffering with some postpartum.
Yeah.
Well, our time is kind of wrapping to an end here. We're about ready to close. Any last, we did get one question about how did you handle stigma or NIMBY. We've got about 30 seconds. Do you want to take 30 seconds and
Yeah.
expand on that one?
I will say it is tricky. We live in a rural area. Not everyone is open to SUD, and especially individuals dealing with medication for opioid use disorder. So that has been the tricky part. We have a lot of neighbors now that are on board, but I will say it took a lot of community outreach in that first like 6 months. So it was just about education and being a good neighbor.
Perfect. Well, I think I speak for everyone that's attended today. This has been phenomenal and so appreciate you and Christy, your time. Again, I was thinking to myself, if I were going to open a program, this is the kind of program I would want to be opening because I just think there's such a great need for it. So thank you again for what you're doing and thank you for sharing your information, your resources, and a piece of yourself today. And those of you who have joined us today, thank you. And if you would like to reach out again, their number is up on the screen. And we hope you'll reach out to them and ask any further questions. So thanks for joining us, everyone, and have a good rest of your day.
Thank y'all.